So good afternoon, everyone, and thank you for joining us for the Washington Global Health Alliance's ADJUevent. Today's discussion is intended to provide a brief guide to the organizations that make up a part of the global health ecosystem and shine a light on the important work that they do. We'd love to get a sense of who we have in the audience today. So when you have just a moment, please complete the Zoom poll on your screen, and we will share the results at the end of this presentation. And I'll just give that a minute. And Kayla, we may want to run that one more time at the end. Okay. All right, so before we begin our program today, let's take a moment to ground ourselves and to respectfully acknowledge the land where we are today. For those of us in the Seattle area, we acknowledge that we are on the unceded lands of the Coast Salish people, including the Duwamish past and present. I would also like to acknowledge the slaves and other forced laborers who built this country where I reside today. We invite you to learn more about the tribal land you are on today by visiting the link in the chat. Okay, so I'd like to give you a little bit of context for our work as global health. It can mean a lot of things to a lot of different people. The following definition was published in The Lancet in 2009 and tends to be the most universally accepted idea for what global health is. And so I am going to go ahead and read this to you. Global health is an area for study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. Global health emphasizes transnational health issues, determinants, and solutions, involves many disciplines within and beyond the health sciences, and promotes interdisciplinary collaboration, and is a synthesis of population-based prevention with individual-level clinical care. So now I'm going to move in to talking a little bit more about who we are, the Washington Global Health Alliance. WGHA was launched in 2007 and connects and informs the global health community, creating a culture of collaboration among members to increase our impact in the world. Many global health organizations either have headquarters or offices in the Puget Sound area, and we discovered that we were meeting people, one another at conferences around the world. They actually lived right down the street from one another. So WGHA helps to facilitate more direct interaction with these organizations, hosting events and creating programs that bring the community together. WGHA currently consists of over 60 organizations, all of whom are dedicated to creating greater access to healthcare and promoting diversity, equity, and inclusion worldwide. As you will see in our slides later, some of our programs include the Women in Global Health Seattle, Communicators Roundtable, Global Health Impact Awards, and more. As stated before, Washington State is an international hub for global health. In recognition of this, WGHA commissions a landscape report updated every 3 years to better inform local, state, and federal policymakers. In our most recent report, we found that we have 165 global health-related organizations, over 16,000 highly educated and mission-driven employees, and a sector that contributes $6 billion to our Washington economy. The presence of our community is truly global, and we are in every country recognized by the UN, which is currently 162 nations. The Washington Global Health sector is unique in its range of disciplines that the community is engaged in. The community is working across everything from animal health, influenced by Washington State University, to digital and mobile technologies, leveraging the strength and core competency of the region. The specific activities within those focus areas include education, outreach, and training is really the top activity that the organizations participate in, as well as research, delivery and distribution, data collection and evaluation and surveillance, product development and manufacturing, funding, and professional services. So now we want to spend some time discussing a selection of the key organizations working in global health located here in Washington and worldwide. We'll start with the Bill and Melinda Gates Foundation. The Bill and Melinda Gates Foundation is a nonprofit founded by Bill and Melinda Gates, dedicated to fighting poverty, disease, and inequality around the world. Launched in the year 2000, BMGF, which is the acronym for the Bill and Melinda Gates Foundation, currently has 1,736 employees. In the year 2020 alone, BMGF had funded grantees in 50 states, the District of Columbia, and 144 countries. For the year ended December 31st, 2021, they had given out 2,051 grants, amounting to $6.7 billion in total charitable support to 1,381 grantees. Additionally, the BMGF runs the Discovery Center, which is on their campus in downtown Seattle. It's a free visitor center exploring the foundation's global charity work via hands-on exhibits and guided tours. As a side note, as members of WGHA, you are invited to join us at the Discovery Center on July 18th for a private event highlighting their new Designing Motherhood exhibition. The link to register is in the chat. So we'll move on to Fred Hutch. The Fred Hutchinson Cancer Center was founded in 1975 by Dr. Bill Hutchinson in honor of his brother Fred, a local baseball hero and Major League Baseball manager who died of cancer. Fred Hutchinson Cancer Center is an independent, nonprofit, unified adult cancer care and research center that also serves as the cancer program for UW Medicine. Fred Hutch Cancer Center was created in April 22 by the merger of longtime partners Fred Hutchinson Cancer Center Research Center and Seattle Cancer Care Alliance. Over 5,700 employees with more than 200 faculty whose research ranges from fundamental science to development of new treatments and diagnostics are working now at this merged center. Fred Hutch receives more National Institutes of Health funding than any other independent research institute in the country. It's over $62 million in I believe that was financial year 2021, sorry. Provides services to over 40,000 patients every year. And Fred Hutch had a leading role in the international scientific response to the COVID-19 pandemic, tracking and modeling the virus's spread, developing diagnostic tests and treatments, learning how the virus interacts with the immune system, and coordinating large-scale cancer trials for the COVID-19 Prevention Network. We'll move on to the International Medical Corps. They are the preeminent first responder that provides emergency relief to those struck by conflict, disaster, and disease, working with them to recover, rebuild, and regain the skills and tools required for self-reliance. The pillars of IMC's work include global first responder, first there, no matter what, saving lives in dangerous, hard-to-reach places, strengthening communities through training and education, and from relief to self-reliance, rebuilding together. The relief efforts involved work in Turkey, Syria, Ethiopia, Yemen, to name just a few of many, many examples. In Turkey and Syria, IMC established 5 mobile medical units to provide primary health, trauma, and sexual and reproductive health services to more than 1,000 patients a week. IMC also delivered 3 trucks carrying 15 metric tons of medications, medical supplies, and cholera kits to support facilities in Aleppo, Hama, and Latakia in Syria. In Turkey, International Medical Corps is coordinating with local partners to address immediate needs related to non-food and food items following the earthquake. They have provided 5.8 million people in Ukraine, Moldova, and Poland with critically needed supplies and health services. They delivered over 280,000 meals to people in newly liberated communities, procured and distributed more than 30,000 packages covering health, hygiene, gender-based violence, and nutrition, trained 6,245 first responders on topics including psychological first aid, trauma care, maternal and child nutrition, and GBV prevention in response. distributed over 1.8 million items of non-food items to conflict-affected and newly liberated communities, and delivered more than 490 tons of medicines and medical supplies, including antibiotics and medicines for pediatric patients, non-communicable diseases, as well as for surgery and trauma. And the relief efforts in Yemen began in 2012, which provides critical multi-sectoral response across 7 governments, which is a very challenging task. Since IMC began the WASH programming in Yemen in 2012, they have reached more than 2 million people, providing critical access to water, sanitation, and hygiene during major cholera outbreaks. So we'll move to PATH. PATH is a global team of innovators working to accelerate health equity so all people and communities can thrive. They advise and partner with public institutions, businesses, grassroots groups, and investors to solve the world's most pressing health challenges. They were launched in 1977. They currently have 1,400 staff globally, working in over 70 countries. PATH has helped to digitize national health systems, track diseases with real-time health data, develop and deploy critical medical devices, and facilitate critical maternal, child, and newborn health programs. While PATH is headquartered in Seattle, they have country offices around the world with highly trained and dedicated staff delivering care at a local level. PATH frequently works directly with other global health organizations to ensure that projects and programs meet the requirements of the region that they're delivered, and ensure that any new technological deployments are safe, effective, and appropriate for that region. So Seattle Children's delivers patient care and advances new discoveries and treatments through pediatric research. While serving as the Pediatric and Adolescent Academic Medical Center for Washington, Alaska, Montana, and Idaho, Seattle Children's has 9,490 total active employees across 10 regional clinics in Puget Sound, Wenatchee, Tri-Cities, Anchorage, and Great Falls, and 24 outreach sites and clinics across Washington, Alaska, and Montana. Over $260 million offered in uncompensated care that was not offset by payments from Medicaid, grants, and donations. And it provided the top 5 outpatient services by volume of visits. We have, they've recorded over 390,000 patient visits in 2022, with the top 5 reasons for inpatient admissions were seizure, chemotherapy, respiratory infections, pulmonary edema and respiratory failure, and bronchitis and RSV pneumonia. Seattle Children's currently has a gross revenue of over $3 billion. The United Nations Technology Bank is a global organization dedicated to enhancing the contribution of science, technology, and innovation for sustainable development in the world's 46 least developed countries, or otherwise known as the LDCs. Established in 2016 and began operations in 2018, the UN Technology Bank supports the LDCs to identify appropriate technologies that address development challenges and facilitates their transfer to 46 least developed countries. The UN Tech Bank strategic plan for 2022 to 2024 has key programmatic areas, which include conducting research and analysis on STI and tech needs, which means providing insights to the policy briefs, reports, and the least developed country insight blog, and support the LDCs to identify technological needs through the technology needs assessment. They facilitate technology and know-how transfer by identifying appropriate and relevant technologies to facilitate that transfer, strengthening science and technical knowledge and capabilities, and supporting STI ecosystem development. They forge partnerships and mobilize resources for STI, supporting inclusive and fair technological development, adopting regional, sub-regional, and interregional approaches to promoting STI. Projects including technology needs assessments, which identify needs, gaps, and priority technology solutions which are appropriate and relevant to achieve the country's development goal. So far, 14 of those TNAs have already been completed. Another example is of the work that they do is the technology lab pilot in Niger. The project is designed for students at the high school level to gain more core digital and other STI-related knowledge and skills, such as entrepreneurship, critical thinking, and teamwork. The Technology Makers Lab is an effective example of South-South cooperation in transferring know-how of the best practices of the LDCs. Starting in 1950, World Vision is a global Christian humanitarian organization that partners with children, families, and their communities to tackle causes of poverty and injustice. In 2022, World Vision donors have the option of sponsoring children in various countries, and the financial donations are used by World Vision to perform disaster relief, grant loans, provide food, and more to individuals in countries all over the world. They've equipped over 3.2 million children through sponsorship, distributed over 156,000 metric tons of food to nourish kids and families, assisted 31.1 million disaster survivors, refugees, and internally displaced people, and helped establish lasting access to clean water for over 3 million people. 18.2 million children and 7.6 million adults benefited from the health and nutrition programs by World Vision in 2016 and 2017 alone. They distributed more than 16.7 million bed nets, and nearly 380,000 pregnant women and caregivers of children from 0 to 23 months received nutrition and infectious disease counseling. Washington State University is a research university that was founded in 1890. They are home to the WSU College of Veterinary Medicine, which includes the Paul G. Allen School for Global Health. This provides innovative solutions to global infectious disease challenges through research, education, global outreach, and disease control. Specific studies in infectious disease, antimicrobial resistance, rabies control and prevention, and zoonotic disease. They provide advanced graduate and postdoctoral training in infectious diseases and immunology, and WSU offers study abroad programs in over 70 countries. ADJUevent is a venture studio, which includes an in-house lab and strategic partnerships with academic and government institutions to bring transformational technologies to market. ADJUevent was the first member of the WGHA Innovation Exchange, which we'll discuss in our next few slides. They were launched in 2020 with offices in Los Angeles, Seattle, and New York, which is and their impact-focused venture studio investing in innovative ideas and products that deliver positive social impact on a global scale. And here's a list of some of our other WGHA members and partners. Obviously, there's entirely too many to go through slides for each one today, but what you can see is that there really is an incredible ecosystem just within the WGHA membership, but all of these have a touch into human and planetary health, and this is what we help to, like I said before, coordinate and facilitate to ensure that these conversations are happening and that that delivery of health equity worldwide can be much more efficient and effective. Okay, so now I'll take some time to cover some of the programs we have at WGHA, starting with our newly launched exchange. The mission of the exchange is to decrease the global burden of disease by accelerating inclusive and equitable global health innovations. The exchange provides an exclusive membership, connects members to identify, accelerate, and fund global health innovation, facilitates private funding and expand global access of relevant IP, and supports innovators to accelerate and scale up execution. The Innovation Exchange platform, Exchange, is being established by Washington Global Health Alliance in consultation with WGHA members and global health stakeholders to progress inclusive and equitable global health innovations. The exchange is building a platform to facilitate, coordinate, and match global health innovation initiatives with private sector funding. Bringing private funders to global health is important because it helps to close the financial gap between what governments and non-governmental organizations currently provide and what is actually needed to support a full scope of health interventions in countries around the world. Innovators will be identified based on their ability to deliver impactful, disruptive global health solutions. Priority global health focal areas will be identified by the strategic exchange partners. And we are now enrolling membership in the exchange and invite you to learn more about it by contacting us. The Women in Global Health Seattle chapter was launched in 2018 and affiliated with the Greater Women in Global Health organization in 2019. Right now, the group consists of over 800 members on its mailing list. There are 5 small groups for women to join to build deeper relationships and network with other women in the community. They include a book club, a career and motherhood group, as well as 2 mid-career professional groups. They're guided by an advisory panel of 14 women leaders. Membership is open to all, and we absolutely invite you to contact us to learn more about joining the Seattle chapter. Field Notes is WGHA's monthly newsletter with over 4,000 subscribers that gives you the latest scoop on Washington's global health community. We invite you to please subscribe and learn more to stay in touch. We found that by sending out our field notes on a monthly basis, we're able to really disseminate the information for our members and the global health community at large, to be able to really stay in touch and learn more about what one another is doing, as well as to highlight special events and programs that are happening. Employees of WGHA member organizations can post jobs for free on the WGHA website. So if you're a manager hiring for a new employee or know a friend who is interested in roles in global health, please refer them to our job board. And Kayla will put that link in the chat. Okay, and so the Washington Global Health Alliance Global Health Impact Awards recognizes the people and organizations that deliver greater health equity and demonstrate a commitment to innovation and impact in global health. At the Global Health Impact Awards, WGHA celebrates the people, dedication, and innovation that runs the global health ecosystem every day. Our event this year will be hosted in person at the Burke Museum in Seattle, Washington on October 4th. Tickets are now available for purchase, and you can still nominate a Rising Star, Luminary Leader, or Organizational Impact Awardee by May 31st. And we'll put those links in chat. We definitely would love to hear about your favorite people working in global health and highlight them through your nomination.